Welcome everybody to our Wellness Wednesdays, the beginning of our nutraMetrix channel sponsored meet-ons for everybody, starting with Mondays with Lauren Sauerbeck, Tuesdays with Brandy Murphy, and Wednesdays referred to as Wellness Wednesdays with myself, Dr. Deedra Mason. If you could do me a favor and just let me know if you're in our chat room, or to look right below my picture, you're going to see a chat box. Let me know that you can see me and you can hear me, and we'll go ahead and get started. Okay, very good. Happy to hear it, Jean. Thank you so much. Great. Well, we're just going to wait for a few more people to join us on our live meet-on. For those of you that are new to meet-on, I want you to know that the forum that we're opening up to here is very much informal, live, and it's here to answer your questions. For those of you that are new to meet-on, I want you to go ahead and locate that text box right below my picture. These are places that you can go ahead and put in any questions that you have in regards to this topic or other nutraMetrix topics, and we'll get those answered. Today's forum, and really every one of my Wellness Wednesday forums, is going to be run just like this. I'll be choosing a favorite topic, sometimes a favorite product or health topic, something new in the news, perhaps something that's coming up frequently in our industry, and I'll share my insights on that topic with you, and then open it up to Q&A, both on that topic and other nutraMetrix related topics. Let's go ahead and just see what kind of questions we have before we get started. Okay. Well, today, and it probably won't be a surprise to you that I want to talk about the topic I will be that I've chosen. One of my favorite products made available to us through the nutraMetrix Custom Health Solutions line or branded line is the vitamin D. And I don't just like it because they named it after me. I like it because it is one of the more effective vitamin D products made available through the professional channel. And that has a great deal to do with its isotonic value. It has a fantastic amount to do with the amount of vitamin D3 that is in this product, as well as the formulators that put K2 in this product, which we'll discuss today as well, so that you have a little bit more insight into what sets you apart in your market and what is your competitive differentiator when it comes to the use of an isotonic vitamin D, as opposed to many of the over-counter type solutions that both patients and practitioners are recommending today. Perfect. Okay, well, I'm happy to have all of you here. It looks like we've got a really good mix of people and a large number of people that were able to log in during this time. Very happy to hear that that's the case. You know, one of my favorite products that was made available to us was made available in February of 2009. This was the isotonic vitamin D3. As a clinician for the last 15 years, I've been using vitamin D and working on testing serum blood levels of vitamin D for quite some time. And some of the real interesting things that I have found with the use of vitamin D, or at least serum testing, is that I haven't found any patient that isn't a supplementing vitamin D patient that isn't already vitamin D insufficient. And there's some common threads there. There's some reasons why. First, we've completely underestimated the benefits of vitamin D in the industry. As physicians, as well as formulators of nutraceuticals, the industry very much for the last 15 years, we'll go back 20 years because the last 5 years we've been very well versed on it. But the 15 years prior, we very simply misunderestimated or underestimated benefits of vitamin D. In fact, not a vitamin at all. It's actually a pro-hormone. And this pro-hormone can be the stepping stone to many other hormones that support the body. And it's not just about vitamin D and bone mineral density, but it's about hormones that build bone as well as manage other hormone downstream end products. These are things like insulin insensitivity, cognitive function and immunity, cardiovascular health, and even longevity when it comes to neurologic health, specifically memory and cognitive function. So these are all reasons why a clinician may choose to use vitamin D to keep the body, from an overall standpoint, very, very healthy. It may be interesting for you to know, and that's kind of the theme I like with this Wellness Wednesdays, is a did you know? Because many of us are unaware of some of the outside benefits of utilizing nutraceuticals. What are some of the quality of life factors that may be of benefit, and some things, little tips or health tips that you can share with your customers, your clients, or your patients. And so I really want to go into this did you know type of solution. So it may be interesting for you to know that every cell of the 206 trillion cells that your body has, every one of them has a vitamin D receptor. That means that vitamin D may be the single most cost-effective thing you do to meet the needs of over 200 trillion cells in the body. Vitamin D receptors are on each one of those cells because it plays a role in the metabolism, the health, or the overall longevity and optimal functioning of those cells. So vitamin D definitely needs to be on your basic 5 of nutrients that you consume on a daily basis. Now, I had said a moment ago that it's not just for bone mineral density. However, that's what the industry focused on to a great extent, with the benefits of vitamin D and the enhancement or the improvement of bone mineral density, whether in a female population, an aging population, or a population that has lower lean muscle mass. And so this may be an infirmed population. Vitamin D has always played a role in keeping bone mineral density within healthy ranges and throughout all different decades of life. But did you also know that it plays a role in immunity? This immunity factor is due to the fact that vitamin D is a prohormone and has the ability to help work with other hormones in the body, even when as it relates to inflammation or immune cell activation, and then ultimately being able to turn off immunity when appropriate. Many people that are concerned with using herbs or botanicals for immunity have turned to vitamin D for its immune benefits. What about cardiovascular health? Well, there's factors that show that vitamin D can, especially when paired with K2, enhance the elasticity and the strength of blood vessels, keeping, again, blood pressure within healthy ranges. Now, one thing that's very interesting in this industry, in particular, is we read labels and we listen to what I will frequently refer to as yellow journalism. Well, we're not always listening to experts in their field, but we're listening to a lot of the things that come out in mainstream medicine. And we've seen it on both sides of the fence when it comes to vitamin D. We have plenty of people that believe that vitamin D, as I said, is the single most cost-effective thing you could do to support your health every day. Everything from bone mineral health to healthy sleep and healthy aging. That being said, there's also those on the other side of the camp that believe that because vitamin D is a fat-soluble vitamin, that you can reach upper limits, and therefore we should very much be cautious, if not conservative, with the amount of vitamin D that we consume on a daily basis. So, some experts will recommend that you don't consume more than 400 IUs should you need a vitamin D supplement. They'll make a recommendation that you will get the rest of your vitamin D through food. An important question to ask you or the patients that you work with or the customers and clients that you work with are how many of you are consuming better than 2 servings of fish per week to be able to get your vitamin D. How many of you are utilizing the sun and no sunscreen or no sun hygiene, one of the factors that will limit the utilization or conversion of vitamin D from an inactive form to an active form that can support the body. So these are just some lifestyle factors that we need to consider. But one thing that you may be interested to know is that when we can see values, lab values of vitamin D3 on measurement to be in a optimal range, and optimal will change by different practitioners' definition, but for me it's going to be making sure that I'm seeing vitamin D at and above a 45 mark and as much as 70 in my patients. Now this is important because what they have found is that just simply having vitamin D at a minimum amount necessary to ward off many chronic illnesses, which is considered 32, you have supported your body when it comes to bone mineral density, you have supported your body when it comes to cardiovascular health, and even immunity to some extent. But did you know that those on evaluation throughout the literature, review of the literature, show that those that have vitamin D levels above 45 have higher quality of life factors, more energy throughout the day? They report that their cognitive function is improved, that their endurance and their Their sense of well-being and vitality is also improved. So while meeting the minimum amounts necessary or being minimally competent will manage some of those health challenges that we know vitamin D can be so helpful, did you know that simply by utilizing vitamin D on a daily basis and keeping your vitamin D levels in what many refer to as an optimal range, not just a sufficient range, can enhance quality of life factors? These are all reasons why I believe that vitamin D may be one of the more important solutions that you add to your optimal health regimen. I want to go ahead and open it up now for questions. Again, if you're new to Meet-On, go ahead and look underneath my picture and you're going to see a text chat box. That text chat box will allow you to ask questions, and we'll open them up and I'll repeat these questions for everyone within the forum, and we'll get those answered for you. So I'm being asked, am I a physician? Yes, I am a physician. I am a primary care physician. I've been in medicine, been practicing medicine for the last, it's going on 16 years now. I have a specialty in alternative or integrative medicine, or integrative approaches to medicine, and have used clinical nutrients in my practice, including supplements in my practice for the last 15 years as a first-line approach or first-line care option for my patients. I'll also use them in concert or in synergy with pharmaceutical interventions, and I would say that that's another point of strength of the integrative practitioner, knowing how to use both alternative and complementary approaches to chronic disease and pharmaceutical or medical approaches to disease, and pair them together quite seamlessly for the benefits of our patients. It's not just about reducing some of our medical benchmarks or biomarkers of disease, but also to meet our patients' needs, to keep them healthy in between office visits. Keep them healthy in between office visits allows us to also offer them better quality of life type solution, a place where medicine frequently fails. So I'm being asked, can you take our multivitamin and our calcium and our isotonic vitamin D3 all together? How do you know when you're taking too much? Well, one of the things that you may be interested to know is that when you put a vitamin D, a calcium, a zinc, a B vitamin, and a multivitamin, it is being ratioed based on that formula for the interaction or synergy of that formula. In and of itself is not a vitamin D supplement just because there's vitamin D in a multivitamin. In fact, all of the ingredients that are in a multivitamin, multimineral, are in a exchange or an interplay with one another, acting on each other. The body does what's called triage its nutrients, and it will decide based on healthy ratios of in milligram or gram doses, depending on how it is that you're utilizing your health and nutrition products. Your body will triage these based on healthy ratios. If you don't have a healthy ratio of folic acid, let's say to B12, then your body won't start to outcompete or compete with one or the other. The same is true for magnesium and calcium, zinc and copper. So they're triaged together in a multivitamin. When they're taken in synergy, we ensure helpful absorption and utilization of those. When it comes to am I getting too much, I'm going to recommend that everybody get your vitamin D, your serum levels tested. Then after you get your serum levels tested, you're going to know if you are in a insufficient, sufficient, or an optimal range, and you'll get a better idea of how, with the help of your healthcare provider, you should be supplementing with vitamin D. After a person gets their levels up to 7, do I recommend 5,000 IUs daily or less? So I'll fall back on the question that, or the answer that I just gave. With regular evaluation with your healthcare provider, under the care and supervision of your healthcare provider, and with sufficient or optimal levels of vitamin D, you'll be able to make a decision about what is your best approach. Many of my patients will choose the vitamin D and they'll take it every other day. They will utilize a lesser amount, or those that have lifestyle factors that may limit their ability to utilize vitamin D. Let's say they are coffee drinkers. Let's say they have a family history of osteoporosis. Let's say during different times of the year they're traveling, or they're put in a situation where they may be immune compromised. It may be times like this where they choose to increase the amount of vitamin D and other wellness products that they consume based on lifestyle factors, unique risk factors for chronic disease, and of course, the things that our patients, our customers are unwilling to change about their lifestyle, so they need to have a higher commitment to supplementation. Coffee consumption is a good example of that when it comes to vitamin D. There are liquid forms of vitamin D on the market, which should not be mistaken as an isotonic form of vitamin D. A lot of doctors will be using a liquid vitamin D, and that's not uncommon. Emulsions are frequently used when it comes to vitamin D because it is a fatty vitamin. And so fatty emulsions are frequently the preferred way to utilize a vitamin D supplement. One thing that's quite interesting about vitamin D3 from nutraMetrix is that it's paired additionally with K2. K2 is also a fat-soluble vitamin that is commonly referred to as the traffic controller of calcium and vitamin D. Is that having a sufficient amount of K2 on board, especially paired with your vitamin D3, that can tell vitamin D where to go. It's this idea of not being sufficient in vitamin D alone or calcium alone, but having a traffic controller that can direct utilization and storage of the vitamin. You know, one question I'm being asked is how do we, when we're working with healthcare professionals or we're working within the professional channel and somebody's already happy with a vitamin that they're taking, how do we get them to change their brand? Listen, the primary factor of any patient or customer's compliance when it comes to a vitamin, a mineral, a nutraceutical is whether or not it produces results. So you're always going to want to ask, are you getting the results that you need from the supplements that you're currently consuming? What were your health goals? What were the goals that you were looking to achieve, and have you achieved them in a reasonable amount of time? If you haven't, perhaps you'd like to consider using an isotonic form with no fillers or binders, or because it's paired with K2. Or perhaps you'd like to consider changing your brand due to cost effectiveness or compliance or ease of use. I'm also going to let you know that if somebody's happy with what they're currently doing, it's helping them produce the results that they were hoping to achieve, you may just want to ask some questions about where they don't currently have a solution in their healthcare regimen and see if something that you have to offer through nutraMetrix can fill in gaps where things like their diet or their supplement choices fell short. One of the questions I'm being asked is if I've ever seen patients have chronically low levels of vitamin D. Those that are being measured through serum with their healthcare provider or with spot testing, which is at-home testing that can be done, benefit from taking an isotonic vitamin D, or do they need to use the prescription? It's an interesting question to ask, specifically because prior to many vitamin D supplements hitting the market, many healthcare professionals were only using the prescription once a week dose of vitamin D, an inactive form of vitamin D called D2, again relying on the body's ability with none of the comorbid factors that would stop the body from utilizing vitamin D, being able to turn it into the active form. So we didn't always, as practitioners, see vitamin D2 or the 1 time a week dose of 50,000 IUs help all of our patients. This is where we had to work on gut absorption or gut utilization. We had to work on healing the gut, the kidneys, the liver. Speak to people about sun hygiene and those sorts of things to ensure that they would get much of what they needed from their vitamin D supplement. You know, one type of patient in particular that I didn't see any benefits with prescription or the fatty emulsions was in the bariatric patient and the irritable bowel patient. Those patients that struggle with gut absorption issues frequently will respond better, in my experience clinically, to the isotonic vitamin D3 with K2, simply because it doesn't worry about, or it works regardless of the health of their gut. So the bariatric patient this works very, very well with, when prescription and other forms, fatty forms of vitamin D3 did not work. And so I'm really happy that I was able, starting in 2009, to be able to offer a product with no fillers and binders that also had a high level of absorption, had a thoughtful formulation with K2, and I was able to see at the root of all of it that their vitamin D levels did come up into optimal ranges when previously, even with prescription, we were well below optimal or even sufficient ranges. You know, I'm being asked about a personal testimony. If I or someone else would like a personal testimony, I understand that you are also able to see people's questions. Perhaps that's something that would interest you. We're coming up, we're rounding out our 20 minutes together. Any other questions that I can answer for you in regards to nutraMetrix, the vitamin D3 with K2, or the isotonic delivery system? One of the things as being mentioned, and we'll let this be one of the last, that one of the doctors that a nutraceutical consultant is working with mentioned that we shouldn't take 6 doses of isotonics at once, as that may decrease absorption. Well, let's talk a little bit about that. Volume is one of the limiting factors. Many people don't want to consume a large volume of fluid. And dividing doses may increase compliance with customers or with patients. That's not unreasonable. Many practitioners will work with patients and want to limit the amount of fructose that they consume in any one sitting. So dividing doses of isotonics is not a bad idea if those are your philosophies in aiding somebody to their health goals. Thank you again, you guys, for being with me on our Wellness Wednesdays. I'll see you back here next week at 1 p.m. for one of my favorite topics, one of my favorite products, and to answer your questions. Have a great rest of your day.